rights, that we had the right to self-protection.
Thank you. Ms. Coppola.
I am a very strong supporter of the Second Amendment. I have spent my life defending the Constitution and the amendments. However, and for one thing, I'm not endorsed by the NRA. I'll just tell you that right off the bat. I believe we've got to have some common sense when we look at guns. I understand weapons. I spent 30 years around weapons. I understand people wanting it for self-protection. I have no problem with that. However, I do have a problem when we have children picking up weapons and accidentally shooting people. I have problems when mentally ill people get weapons and hurt themselves or others. So I think we've got to have some common sense along the way, that people that are on the no-fly list, they shouldn't be able to get weapons. People that are abusers shouldn't be able to get weapons. I think there are a lot of things we could do. We could be looking at biometric controls on weapons so that, a child couldn't pick up a weapon and accidentally fire it. There are a lot of initiatives that if we got away from this fear that anything that is done with gun control is going to infringe on our Second Amendment right, that we could do that. We could have both the right, the protection, we could execute our right of the Second Amendment, but we could also do it in a reasonable and safe manner that might reduce some of the violence. I also think that we really need to start looking at that relationship between violence and guns, and that we ought to have the National Institute of Health really start looking at what are those causations. That was legislation that was passed at the federal level several decades ago that forbid that. So yes, I am a strong supporter of the Second Amendment, but there are two very important words in that amendment: well-regulated. And so let's get some common sense and let's get some regulation in place, because we have to deal with this growing epidemic that's happening in the states of violence. Thank you.
Thank you.
The next question's about Medicaid expansion. And Mr. Bossert, you'll go first. Question is, right now, more than 500,000 North Carolinians don't have health insurance because North Carolina legislators have voted not to expand Medicaid. By not expanding Medicaid, North Carolina has already lost over $6 billion in federal funds alone, the funds having gone to other states, and this decision will cost the state billions more. These effects will include not only federal funds lost and mortality rates, but also jobs and business activity not created. What are the reasons you, as a legislator, would support or oppose expanding Medicaid?
Well, I would support the expansion of Medicaid here in North Carolina. In addition, there are really two very powerful reasons. One has to do with money, jobs. The other has to do with human beings. In my work as a school administrator, I work with children all along the spectrum financially. I see children who come from very poor homes and children who come from very wealthy homes, and I see them every day. I know that my focus is always on kids and the future of our state. I believe we need to take care of those who are least able to take care of themselves. In the expansion of Medicaid, we would bring $2 billion a year back into North Carolina's economy. This is money that we are already sending to the federal government every year and can have returned to us. In the process of doing so, we would create, according to the Budget and Tax Center here in North Carolina, we would create approximately 23,000 jobs, good-paying jobs. We would improve services, medical services, to our rural areas. Anybody here who lives in Transylvania County has noticed that our regional hospital there has had a diminishing level of service to the community. And I believe that expanding Medicaid could help bring services back to our rural county and to rural counties all over North Carolina. So we can improve services, we can help children, we can bring jobs into this community, good paying jobs, by the way, by people who will be good paying taxpayers. And those jobs will ultimately serve the interest of some of the people who make less than $10,400 a year working in substandard pay jobs. Substandard pay jobs that make it impossible for them to buy their own insurance. We can do better, and we need to have that net out for those folks making very little money, because it saves lives and saves children. Thank you.
Thank you. Mr. Henson?
Expanding Medicaid without meaningful reform only accepts a status quo that not only fails taxpayers, but it fails patients as well. Before we look at expanding Medicaid, we need to actually fix Medicaid. Tossing more money at a problem is not the way to fix it. That only wastes taxpayer dollars. So before we even look at expanding Medicaid, we need to actually fix the problem.
Thank you. Ms. Coppola?
We should expand Medicaid. It's a win-win situation. It's the right thing to do. 400,000 low-income people in this state would have health coverage. Everybody should have health coverage. It shouldn't be dependent on your level of income. But it's also good for the economy. It creates jobs. It brings in revenue. It helps deal with the uninsured patient cost that's really crippling our rural hospitals. We're already paying for health care for people, but the way they get the health care now is they go to the emergency rooms. That's the most expensive type of care that they can get. And then when they're uninsured, who do you think pays? It gets paid because the hospital and the insurance companies, our premiums go up, our health care costs go up. We're not saving money by not expanding Medicaid. We actually have a much greater health care cost. Now, I just think that we need to get away from the partisan politics, and we need to look at all the facts that surround an issue like this. And we need to ask ourselves, is it something that is good for the people of North Carolina? And when I ask that question, it is good. It helps the low-income people. It helps the economy. It's money that we are already paying that is going out of the state that would be used here. And again, it helps our healthcare system. So this really is a win-win situation. And we need to get away from the partisan politics that has kept our legislature from approving that. Thank you.
Thank you. Mr. Edwards?
Madam Moderator, I would ask that you read the question again, not this slanted, biased statement at the beginning, but just the question.
Excuse me?
I wanted the question read.
What are the reasons you, as a legislator, would support and/or oppose expanding Medicaid?
Thank you very much. I appreciate that. Obamacare is a failure. It's clearly a failure. The answer to Obamacare is not more Obamacare, which quite frankly is the offer for Medicaid expansion. North Carolina already has one of the most generous, one of the most liberal Medicaid budgets in the United States. We're going to spend $3.7 billion on Medicaid this year. That was increased in the short session by about $100 million over last year. The carrot that's being hung out there by the federal government for Medicaid expansion is just that. It comes with handcuffs. It will cost North Carolinians $6 billion additional in the next decade. It's scheduled to phase out. Our $3.7 billion that we budget now is adequate with a good working Medicaid system to support those folks that really cannot afford to work and get insurance themselves. We just have to look outside our own borders to other states. Kentucky is desperately trying to get out of it. They've gone to the federal government and asked if they can essentially modify it because they claim that it is unsustainable. Indiana is going bankrupt right now because they have a $6 billion deficit because the federal government with Obamacare continues to change the rules on them. They hung the carrot out to Indiana. Indiana grabbed it. Then the federal government started changing the rules on them, and they're in a situation now where it is just totally unsustainable. Ohio is in the same exact category. Our legislature made the right decision by not expanding Medicaid and to focus on fixing the program that we have now that is more than adequately funded.
Thank you. There's a rebuttal, Mr. Bosser.
What are we gonna do now? I'll pay you $5 for yours. It's very simple. I just want to bring this down to where it really belongs. The discussion needs to be about families who make less than $10,400 a year. These families are not receiving adequate medical care. They are going to the emergency rooms for their care when they need it, when they're sick. They don't have preventive care. Sometimes as a school principal, you find yourself going to the hospital with a child whose parents can't be located, and you have to act in loco parentis. And I will tell you that when I do, sometimes I talk to the nurses up there at Mission Hospital, and they tell me how many people walking in the door have no insurance at all. It's not a secret. Medicaid expansion would help save lives, thousands of lives every year. We need to do it. We need to do it now, and we need to stop arguing. If the legislature wants to debate the way they're handling the problem, fine. Let's let them do it, but first let's expand Medicaid, and then we can deal with the aftermath of that, which I think is going to be a very positive aftermath. Healthy kids, healthy care.
Thank you.
The next question is for Cody Henson. This is a question about the equal rights. If elected, would you be a sponsor or co-sponsor of a bill in the General Assembly to ratify the ERA in North Carolina?
I believe in equal protection under the law, something that's already afforded to North Carolina citizens. I believe everybody has the same rights as everybody else in this room, regardless of where you're from, how much money your mama and daddy have, what color your skin is, or anything like that. So my answer to that question would be no.
Thank you. Maureen? My answer would be yes. We should have ratified this several decades ago. And it's time that we have equal rights. It's time that women get equal pay for equal work. This country is all about equal rights, about treating people equally. And it's a shame that this legislation has taken this long to make it through the various different states. North Carolina should step up and should ratify the ERA today. Thank you. Mr. Edwards?
I filed to run for this office on December 1st. That's the first time that question has been posed to me. No one has come to me and asked me to consider any specific legislation to make a change there one way or another. What I could say is if somebody's got some ideas in the way that it should be changed, I'd be certainly open to do that. I believe that one of the great things about this nation is that we should treat one another equally. And so to sum that up, I would just ask for people to give me feedback. And part of the beautiful thing about representing people is you listen and you fashion solutions that meets the greater good. That's what I would do in this situation.
Thank you.
I'd like to give you some feedback. Well, I listened to you before, that's respect. I am all for the Equal Rights Amendment and it being adopted. The plain fact of the matter is we still have inequality in salaries, and that's an unacceptable situation. But there are other issues that go with the Equal Rights Amendment as well. I think the shortest and quickest way to respond to the Equal Rights Amendment is to say this: there is no harm in passing an amendment that guarantees the rights of citizens who are not treated equally right now in the United States. It is a hold harmless amendment. And that's a fact. Now, I would say this too, that when we lift up the rights of women and guarantee them equal pay, we all win. We all win. And when we all win, we're all lifted and we all win. So to me, the Equal Rights Amendment, and Chuck, I would just like to recommend very highly that you give it very serious and